In the space of 30 minutes, we've done a substantial assessment, which found out all his imbalances. We've done a little bit of activation with a release of his psoas, and that's all the soft tissue we've done, but mainly activation. And he's gone from not being able to touch his toes to be able to flex fully down with no pain at all.
So you're gonna like map my entire body?
Yeah. So
that's crazy.
So shall I show you a case study first, and then we can
whatever you like. Honestly, whatever you want to do.
So it doesn't do body composition as such.
Yeah, I'm really hairy at the moment. So.
But it does, what it does is more like postural, analytically finding anatomically your body
so
joint
I think
positions.
I have a slight bulge on like L4, I think.
Yeah.
I think L4, L5 I have a bulge, but it's only slight, so it doesn't press on my sciatic nerve. I think
Unless
it presses.
under load?
Sorry?
Unless under load?
No, I just get tight QLs because I have very tight ankles, so I can't really squat.
Yeah.
Safety's bar. But I'm going to let you work it all out.
So essentially, this is what it shows you. So it shows you anatomical positions, and we're looking at how symmetrical you are from left to right. It gives you a grading from A to E, A being absolutely fine, low risk of injury, E being very high. So this is just the postural one, and we can do a movement-based one as well.
Okay, but you want my feet narrow, because I would never normally stand like this.
Just for the time being.
See how much I pronate?
Stat.
Look at this.
Yeah, pronation's not a problem.
Yeah, I don't think it causes me pain, but...
Is it you've always been fairly flat-footed or pronated, or is it as a result of an injury?
No, I don't think I used to pronate. I think when I got heavy,
okay,
like I went to 130 kilos and I think they collapsed.
Just a lot of weakness, probably into tib posts, perineals.
I do now train more adductor. Like my training now is all more fitness. Alex will tell you, it's literally very fitness-specific training now.
No, so what I'll do is I'll just make sure I scan the room, make sure we get a baseline, and then go from there. Okay. So we're just going to step to the side. We're going to do the static postural assessment, and then we're going to do movement. So we're going to do overhead squat.
T-shirt off.
We'll go t-shirt off. So we're going to go toes in line with the red line. You can stand nice and tall for me. So generally, when we look to do a scan on your posture, a lot of the time you will try and correct it. So I'm going to get you to look past the camera, look at the screen in front of you. You're going to go a nice deep breath in. On the exhalation, you're going to relax your shoulders down. Good, amazing. From there, you're going to rotate to your right-hand side, 90 degrees, so you're going to go toes in line with the yellow line for me. And again, looking straight, keeping your eyes forward, relax your shoulders down. Perfect, we're going to rotate towards the right-hand side one more time, toes in line with the green line. Good, relax shoulders down. Very good, staying where you are. You're going to go hands on your knees with your back bent. So flex it naturally with your legs straight.
I've got a tight back.
Tight back, you can feel that already.
Yeah, my back's fucked.
Yeah, and then chin to your chest.
Should I go as low as I can?
Yeah, perfect, and relax there. Amazing.
Do you want me to go as lower?
No, that's perfect. So we're going to take you through an overhead squat.
I need to stand wide.
Yeah, that's fine. So with this one, as long as you're in line with the red line, you can go as wide as you want. Okay. So before we start anything, we're going to get you to step off the mat one more time, because we're going to scan the room to get a baseline. So we will pop you into the mat. I'm just going to position you properly because you need to be fully into the camera.
Sure. Do you need shorts off?
No, shorts is okay. So let's just shovel back a tiny bit. Go arms right above your head. That's it, palms facing in. Take half a step back. Yeah, that's perfect there, okay? So go as wide as you need to go with your squat stance. From here, you're gonna go palms facing in, stretching your arms right above your head. Palms facing in for me, perfect. In your own time, I'm gonna get you to squat 5 times as low as you physically can. Take your time with it. When you're ready, off you go. A little bit stiff from this morning.
No, I'm worse with this usually.
Yeah, last one. All the way, all the way, all the way, all the way. Good, there we go.
My arm's coming down there.
And rest there.
I've never done overheads.
You've never done overheads?
No,
Yeah. Now, in your own time, we're going to do a single leg squat. Okay, hands on your hips, feet into the middle of the line. Yep,
I
sorry?
don't think I'm strong enough for a single leg squat.
This will highlight a lot of the imbalances then, and that's essentially what we're going to do. If your single leg squat is relative to whatever depth you can hit, okay? And I don't want to show you a single leg squat because the idea is I don't want you to copy my movement. It's all about what your normal mechanics are.
You do it?
Yeah, just feet on the line. Yeah, that's it. Just step forward slightly. So this won't be recorded, this one, okay? So you're gonna go feet on the line, foot side by side, one foot slightly higher than the other, hands on your hips, looking straight forward, off you go in your own time.
I can't go lower than that.
Yeah, just whatever your body...
I only started them a week ago when I was doing them assisted with the big thing, holding the thing.
In your own mechanics, take your time, hinge for me, bring the chest down, push your bum back, just sit down on a chair. Okay, keep going, keep going. Good, and then back up, that's it. You're gonna do 5 on each leg.
Can I put the leg back?
Just keep the toe, yeah, that's it, back's fine. Yeah. This is perfect. That's it. All the way, all the way, all the way, all the way. Good, well done, arm rest there. Well done, that's it. Perfect. Right, we'll sit down and have a little look at the data.
Oh, that's it?
Yeah, that's it.
Is that the test?
That's just the actual scan, then we put you in and do the testing on the plinth. Right, so in terms of your findings here, you can see we've got gradings from A to E. So your grading is C from the frontal plane, sagittal plane, and then frontal plane you've got D, and then you've got B. So the higher risk of injury potential is essentially your neck posture. And this will explain the restrictions of your shoulders above your head.
And I also get tight, I've had spasms here before.
Yep, so it's SEM, sternocleidomastoid,
Really,
your
when you've had a spasm
scalenes.
there, then
Yeah.
I've got to shorten it and hold my arm up.
Yeah, to take the pain
Yeah,
away.
otherwise it's like, it's happened a few times.
Interesting,
before.
interesting. There'll be a reason why, and more than likely I can already see the driving forces. So on this side, we're looking at how symmetrical you are from left to right. And obviously you can see straight away on that left shoulder, you've got a slight 4 degrees incline. You've got a slight hip hike on the left-hand side as well with 1 degree. This is what I was saying about your hip being slightly wonky.
Is it my hip that's actually pushing my shoulder up?
We don't know yet. So the idea is this is just the metrics that we collate to start with until we put you on the plinth and we test why. Because the idea is if we test every structure, we could be here for days. So if we go into the actual skeletal structure, we can see now scoliosis, about 4 degrees. So you can see a slight curvature from left here.
Should I even be worried about that?
To right, no. Okay. I'm not worried about it at all. You've got bigger elephants in this assessment to address that will resolve more for you than a tiny little scoliosis. Okay. Now we're going to look at your movement-based assessment. You're not bad, double leg, single leg is a different matter. Okay.
The video is sick.
So the idea is this, we're looking at center of gravity. Where should your center of gravity be when you're squatting?
Across like a tripod.
Yeah, but it should be centered.
Yeah.
There should be no deviation to the left or the right. So top is left, bottom is right. Can you see with each squat, your body is trying to find the path of least resistance. And that path of least resistance is shifting your body weight or your hip from right there to left there to right there to left there.
Is that okay? Is that or not?
Ideally not. We want you to be bang in the middle. So this only leads where the assessment goes. Okay. Yeah. So then in my brain already, I know question mark here, question mark here, question mark here, and then that dictates what I test on.
So you don't do what like someone would do inaccurately. They'll just say, "Oh, that's tight. We'll just external is tight." They just literally just do that.
So you got active, passive range of motion. Then we've got strength testing. Then we put you in certain positions to test strength where your muscle can't hide the weight.
You've got so much more indication with data.
Yeah.
Then you do the testing. That's sick.
Yeah. Because the point is, if we don't see markers, the thing is overhead squat's great for assessment. Yeah. However, it doesn't tell you exactly what's going on. Everything is a probable. So then to confirm the probable, we have to then isolate and test. So first of all, we're going to take you through active range of motion just to check the key movements of the hips. So in your own time, we're going to do hip flexion on this side, so straight leg raise.
Sorry.
Yep, so it's nice and slow. Good. What's stopping you from getting any further? Is it your quads or your hamstrings?
Hamstring.
Good, and then from there, let's go on to the other side.
Hamstring.
Good, and back down. Okay, so I'm going to do it passively for you. So you're going to stay nice and relaxed. So you have the ability to get beyond that.
My hips are lifted up.
But you can feel, like you said, there's a bit of torsion there. Okay.
Feel free to over-explain things, Jason.
Yeah.
For your camera.
So from here, we're going to go into external and internal rotation. So we're going to keep your knee at 90 degrees. Try not to move the knee itself. You're going to pivot the foot up towards your head, and this should start with. Off you go. Good, not bad, not bad. Roughly about 50% of what your body can achieve. So I'm going to do it for you now. So if you visually see, this is how much range your body has to achieve. This is how much range your body's actually using. So roughly about 60%.
So is that because I'm doing something wrong? Should I be able to access all range, or is passive always more, isn't it?
No, not necessarily. Passive should be more. However, we want them to be matching.
Really?
Yeah. So the idea is if you've got range through the hip, but your active range can't match it.
It's a weakness.
Exactly. It could be an element of weakness, could be an element of mixture of tightness and weakness.
Wow.
Okay. So the thing is, then let's say if you did get into accident, or let's say if you're back squatting and your body then enters that new range where you can't actively go into, but let's say the load pushes you into it, what's going to happen there? Injury straight away. Okay. So if your body has the range, we should be able to access that full range. So now check in your internal rotation. So hold it in place. In your own time, you're going to pivot your foot out towards me. Not bad. Starting to pinch on this lateral hip.
Yeah.
Yeah. Okay.
It's not a pinch. I just don't get there. I don't even think I'll get far enough for a pinch.
Okay. No worries. Let's go same on this side. So hold this in place in your own time. Slowly turn the foot up towards your head. Good. A little bit better than the other side.
Yeah.
Okay. And stay nice and relaxed for me. So you have the ability to hit just under 90. And where can you feel that straight away? In your glute.
Yeah.
That's it. Holding yourself in place, you're going to go into internal rotation without hiking your hip. So you've got slightly less on this side. Okay. So when you squat, there should be an element of relative internal and external rotation that happens at the hip. That's a normal motion.
Yeah.
If you don't have the motion there, then you won't be able to use it. Okay. We're going to go, just check abduction. Okay, it's not too bad. Good, and let's turn you onto your front. Good. Arms by your sides or off the bed. In your own time, you're going to do a straight leg extension on this side. Very good. And back down. Does this trigger any of your symptoms or any of your pains or aches?
No.
Okay. Let's go on.
It's not pain.
Let's go this side and relax there. Perfect. So to achieve both motions, you are unable to get full extension coming up. You have to rotate the whole body to actually get the leg off the ground.
Yeah.
Okay. So I'm going to bend the knee. You're going to lift the hip up, hold it in place. In this position, so I can see there's a lot of weakness through here. So you're not even able to hold the leg up, and as soon as I press down, there's no resistance at all.
That's glute weakness.
Yeah, glute weakness. And then let's go this side. So let's just position you up, hold it in place. Now, don't let me push you down. Straight away. Okay. So the inactivity of the glutes, it could be to do with tightness, it could also be to do with the weakness. Okay, leg length seems okay. Okay, yeah, a little bit of tightness in the QL, but overall, not too bad.
Until it feels disgustingly tight.
Let's turn you onto your back one more time. I'm going to test your hip flexors. I think this is where your biggest issue actually comes from.
Yeah, it is. It is all hip flexors. I said that to you on the phone.
You said hip flexors. So the hip flexors itself is, I'm actually going to target more your psoas.
Oh, fucking hell, you're going to poke it.
Not at the moment, okay? So we're going to go knees up beyond 90 degrees. Okay, you're going to hold this in place, so without the hands, just with using your muscles. Good, holding this place, do not let me move you, okay? See, that doesn't fire at all.
Let me go again.
So from here,
Try again.
yeah, and then don't let me move you.
Yep.
See how hard it is? At 90 degrees, hold this in place, don't let me move you.
That's going to be...
No, this is solid, yeah? You notice the difference?
Yeah, so is that psoas?
Psoas is weak, iliopsoas is fine. Okay, so iliopsoas joins from the ASIS down. Psoas joins from T12, L1, L2, L3, L4, all the way through and joins into the ASIS.
It's a good test, that.
Yeah. It's simple. The thing is, you don't overcomplicate the assessment. Hold it in place. No, don't let me move you. You see that first initial shake, there's just no resistance at all. 90 degrees, hold it in place, don't let me move you. Solid, absolutely fine, okay? So the thing is, you've just not had to work within this range, hence why there's a bit of weakness. So if you go back to your lower back tightness, do you know how you used to say your QL keeps locking up?
Yeah.
There's no reason for your QL because it's probably not a weakness to your QL. It keeps locking up because it feels vulnerable or it feels like it's overworking. What's tight, I'll guarantee, is more the psoas.
Yeah.
Okay? So we're going to get you up. We're going to try and touch your toes. What we're going to do is put you back on the bed, treat your psoas, and then retest again.
Okay.
Okay, in your own time, feet facing straight, hands on your legs. We're going to slowly use each segment in your spine. You're going to flex down, stop at the point of pain.
One vertebra at a time.
Oh yeah, just let your body flex down. I want to see what your normal mechanics is first, and then we can go from there. You've got a little bit of lumbar flexion, but a lot of it's coming from. Does that cause you any pain?
Yeah, it's all tight and the lower back's tight as well.
But you can feel it through here. Again, you're going to extend up, looking up into the ceiling, pushing your hips forward. Does this cause you pain?
It's like discomfort.
Discomfort, and it's right in the center point,
Yeah.
or to one side?
No, right in the middle.
Right in the middle, okay? From here, you're going to run your arms down the left-hand leg. Very good. And then we're going to go on to the other side.
Oh, a shock.
Straight away.
Yeah. What does that mean?
That's better there. So with that side flexion, you are compressing that side of the disc, which then pushes the nucleus out towards the opposing nerve root.
That's the bulge, isn't it?
Yeah. So more than, because you said you had a history of a bulge, didn't you?
Yeah, I've got a picture of it if you want to see it.
Yeah, we'll take a look at it and then we can obviously add that in as well. Let's turn around for me. I'm just going to check your SRJ. So I'm going to lower the hips slightly there. Okay, in your own time. So we're going to do a special test. I'm not going to tell you what it is just yet.
Feet natural or
Yeah, just feet
straight?
together, feet together. Doesn't really matter what stance, so a bit closer together. Right next to each other. Very good. In your own time, from here, you're going to lift your right knee up towards your chest without holding the knee.
It's going to shift.
Yep. Very good. And back down. One more time. Good. And back down. Let's go left side. Very good. Now from here, let's go left side one more time. Good. And let's go right side. Okay, interesting. So you are showing a sign of a right sacroiliac joint dysfunction. So even though you get a lot of your symptoms through the left,
Yeah.
your right
So is
side,
my SI like this?
yes. So your SI is slightly,
Yeah. Right on right. You don't know if you use that term. Do you know the SI?
yep,
In some osteos would say it's right on right.
yeah, right on the right side essentially.
Yeah.
So that then
Yeah.
coincides with your scan, if you remember.
Yeah.
That right side is deviated forward by 8 degrees. So what we would do is, even though your symptoms on the left-hand side, you mentioned that you had pain down the left SRJ last time we spoke.
Yeah.
So I would say this is a symptom as a result of the lack of mobility of the right SI. Okay?
How do you make your SI more mobile? I don't know how to do that.
It's a passive motion. There's no active motion of SI. There's a passive motion with the
Yes,
ball and
the SI
socket
is just there to.
it's like a glide.
Yeah.
It's like a glide. So when you go into normal gait pattern, as you step forward, there should be an element of anterior and posterior tilt. So all we're going to do initially is we're going to hit the psoas. Okay? I'm assuming you've had psoas released before.
Yeah.
It's going to be a little bit uncomfortable to start with. So we're going to go and we're going to push straight down and we're going to trigger point the actual psoas muscle. So to do that, we're going to cross your arms across your chest. You're going to do a slight crunch for me, pulling your elbows down towards your hips. A little bit more, so crunch up, very good. And then we find the border now and you're going to relax all the way back. This is our way of making sure that we're not going to be pressing on your intestines, okay? So nice and relaxed, you're going to breathe in, you're going to inhale. On exhalation, you're going to stay nice and relaxed. You're going to feel me sink into the tummy. And then we're going to get that exact point right there. Just to confirm we're on the right point, lift your left knee up towards your chest. Bend the knee. Yep, all the way up, past 90 degrees. Good, can you feel that muscle contraction there?
Yeah.
Now pop the foot down exactly where you are. You're going to abduct the hip, resting the knee out onto me. And you're going to just feel that pressure just there. And just short breaths and just control the breathing. That's it. Very good. So we're now going to try and use a bit more nasal breathing. In for 4 through the nasal cavity. That's it. Out for 4. 1, 2, 3, 4. Perfect. We're going to do 3 of these. 1, 2, 3, 4. Perfect. Okay, last one. Good. How does that feel now? Eased off quite a lot? Good.
Yeah.
So 80% of your nervous system runs through your diaphragm. So the more you use your diaphragm through breathing patterns, it helps us by managing pain. So as I shift the finger, that's going to come back slightly, and we're going to hold there as your last point. Now breathe in again. Slowly let your hip abduct. Just let it drop out fully. Perfect. As you abduct the hip, because of the joining point of the psoas, you're going to feel the pressure increase onto my finger. Very good, perfect.
Oh,
Do you feel that traveling down into your groin?
no, I just feel it in my stomach.
Okay. So hope you've not eaten in the last half an hour.
I've always eaten.
Yeah. And then now let's relax there. Okay. Now just straighten up your leg. How does your back feel laying onto your back?
It feels fully released.
It feels much easier on the left hand side.
Completely released left.
So what we're going to do is exactly the same on the right hand side again. Okay, you ready? Arms across your chest.
Am I a good patient?
Yeah, you're doing well. See some people fighting, throwing their fist at me straight away when I'm digging in. Deep breath in, and all the way out. And just take it slow.
No.
Take your time, take your time. That's it. Okay, just before you're going to confirm on the right spot, bring your right knee up towards your chest. All the way up, all the way up, all the way up, all the way up. Right there, that's it. Now popping the foot down, you're going to abduct the knee. Good, holding this position, just continue with your nasal breathing, that's it. Each position we're going to do roughly about 3 to 4 breaths, or until the pressure eases off by at least 50%.
Should I expand out and I breathe?
No, just breathe as comfortable as you can. Don't force the expansion. Very good. Good. I'm going to change positioning. It's going to come back slightly. Okay, take your time. That's it. I'm going to take it off 10% just so you can adjust to the pressure. Very good. And just do 2 more of those. Very good. I'm going to shift to the lower portion. Just hold here. From here, you're going to allow the knee to drop out. Nice and
Alex,
relaxed.
you've seen everything now.
You're next. You want to have a go? And how does that feel there? That's eased off quite a lot, hasn't it?
Yeah, my lower back's released as well.
Yeah.
No, you just stop shouting at me, I'm working.
So your body's trying to guard itself as a weakness from here. Okay. Very good. Okay, with any muscles that we release, we then have to activate to make sure that they're fired on to help you stabilize. Okay. From here, before we do anything else, we're going to sit you back up. We're going to test your toe touch. Okay. If you need to rotate. Yeah, that's it. Is this how you normally get out of bed as well?
I think I'll just slide out and die.
Yeah. Okay, in your own time, that's fine.
No, sometimes I do spring out in the morning. I've got loads of energy.
So let's go and go side on. If we go side on, then we can get a better profile, just roughly about there. That's it. From here, slowly flex forward. Now, what I'm looking at is the quality of the flexion. Just keep going. That's it. We're looking at quality of the flexion, but also we're looking at symptoms. How does that feel in your lumbar spine now?
Loads better.
Yeah,
Fully released.
Can you see now it's much easier, and you can see each segment flexing into the lumbar spine. Okay. We still need to address obviously the tight hamstrings. Yeah. Still need to address the glutes, but band for buck wise, this is probably the best release for you straight away.
Feels so much better. My lower back's like instantly easy.
We haven't had to manipulate yet. Yeah. We haven't had to actually release at the QL. And this is where I want you to establish is releasing the QL constantly, it's going to keep coming back. The QL is only there as a stabilizer. So if your hip flexors or your deep psoas muscles are not working to help stabilize the spine through flexion or extension, or even just through a compound or squatting, it should be isometric contracting, then your QL has to kick in. So first of all, I'm going to help pull your SI into a posterior tilt. Okay, so you're going to pull the bottom leg behind you. That's it. You're gonna wedge this into my hip, and you're gonna stay nice and relaxed. I'll do everything for you, okay? You're gonna stay super relaxed, rest your head all the way down. So I'm gonna anchor the front of the ilium, back of the ilium. As I pull your hip into flexion, I facilitate that posterior tilt. So then the ball and socket joint for the hip and the ilium move together. So there's a little bit of coupling of movement. So let's say if you're doing a box step up, if you're trying to get the knee high, you need to allow for this ilium on the right hand side to posterior tilt with you.
Little click.
Sorry?
Little click.
And into the L5.
More, I think it was a bit higher. Though.
Okay. And exhale. And I'm going to do end range pulses. Breathe all the way out. Good. All the way out. And last one. Perfect. And rest there. Okay, we're going to turn you over. We're going to do the other side.
So do you put different amount of pressure in depending on the side that you're doing?
But also it depends on the feel.
Yeah.
Well, it's
Your
about
feelings with the
treating what
movement.
is in front of me rather
Yeah.
than just assuming that this is the replicated treatment I'm going to do. So stay nice and relaxed for me. You're going to extend this leg behind you, hold that in place. Good. You're going to pop this elbow just there for me. I'm going to lock this in. That's it. And then as I pull into flexion, can you feel that has a bit more resistance and a bit more resilience than the right side?
You know, like where the PSIS is?
Yeah.
It's like, not pinching, but I can feel a pull.
Now,
Like when you go to the top.
just there.
Yeah.
Yeah. So this is where,
Because that's where that tendon is that connects to the hamstring, yeah?
which one?
You know, PSIS.
PSIS is the dimple in your back.
Sorry, no. What's this one called?
Oh, ischial tuberosity.
Yeah, that
Yeah.
one.
So
has
that's
the
where your
tendon
hamstrings.
Yeah.
Yeah.
So I can feel tightness there when you go
Okay.
right to the bottom range.
So that will be more to do with me putting tension on the glutes. The glutes is restricting the hips from moving any further, so then it feels like the hamstring's pulling. But really the hamstring's in a shortened position because I've flexed the knee.
Yeah.
Good. Now if you feel the SI, you see now it's spongy.
Yeah.
Yeah. So just by doing that mobilization and release of the psoas, let's get you standing up. And let's flex one more time. Don't think about it, let your body just fully flex.
That's amazing.
Perfect. Well done.
Oh, God.
Remember, I haven't had to manipulate yet. That is an element we would do after as well.
Dropped straight away.
Yeah. And to think how tight it was before,
That was such a relief.
what I'll also do is I'll do some prime, so even just releasing that lumbar spine,
Yeah.
can you feel that neck doesn't feel so as extended?
Do you know when I was here before? It was like this.
Yeah, exactly. And I've not touched any of the thoracic
So
just yet.
my thoracic is actually less like this.
Yes,
Because
as a
you've-
result of
Yeah.
the hips
Because
loosening.
my also my lower spine is actually on that. It's like dropped.
It was basically trying to posterior tilt
I'm
the
not
whole
like
time.
this now.
Yeah, exactly. You can see the knock-on effect up the chain. Okay.
Yeah, it feels really good.
So let's start activating. So normally I can do a banded activation for you. That's what you would do by yourself, but you've got long ass legs, so the bands aren't going to reach that far, so we're going to do it manually, okay? So you're going to bring your knees up to 90 degrees. You're going to hold yourself in place. Yep. The aim is you're going to brace your abdominals. Imagine I'm about to hit you, so brace. So you're going to push out. So don't suck in, push out. Perfect. Hold it there. Now, it's trying to tuck your hip underneath you. Perfect. Straighten the opposite leg. Toes up. And you're going to drive your leg straight down into the bed. So you should feel opposite glute firing. This side, psoas firing. Okay. Now holding here, build up resistance. Come on, keep working. Work a little bit more. Come on. There we go. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And relax there.
My trainer's been making me do wall sprints.
Wall sprints.
Wall sprints, yeah.
Like drill, like
Well,
single
put my
leg
hands on the
exchange
wall.
and then driving.
Yeah.
Yeah.
And because he said I had the same weakness as well.
The problem with sprinting is not gonna. As soon as you add anything that's power and speed, your body always go back to what it knows best, which is tighten up.
If you can tell him.
Yeah, I'll address this. The thing is, based on your assessment, I'll give you a prep program. This prep program you do before every one of your sessions.
Okay.
And then what I'll do is I'll speak to your PT so that you can alter certain movement mechanics.
I'll record those for you. If whatever you need, like.
Yeah, that's fine. Let's go this side again. So your left leg, toes up, leg straight. Good. With a straight leg, you're going to fire on the left glute and you're going to drive this straight down into the bed. We're keeping your hip in contact. Slight posterior tuck of the hip. Very good. Keep this leg straight. Bracing your abdominals. Slowly build this up, but make sure you breathe, Ismail. That's it. Hold it there. 10, 9, 8, 7. Breathe from the tummy. Better. Well done. 5, 4, 3, 2, 1. And slowly relax.
Every time I was pushing up with my right, I could feel my left glute squeeze.
Yeah, remember, what are we trying to always carry this over to real life?
It was glute max, not glute mid.
Sorry?
It was glute max squeezing there.
Make sure of all the glutes. You can't isolate one glute.
Okay,
either.
I would feel it more at the bottom of the glute than the top.
Yeah, you can get glute max, a little bit of piriformis. That also is
In my actually
hamstring.
in performance, it was like I could feel it right there though.
Right on the seat bone.
Yeah.
Probably hamstring.
I feel
Then.
it exactly there.
Probably more hamstring firing. So even just doing that, now let's bring this knee up to 90 degrees. Hold that in place. Now, do not let me move you. Okay, go. See how much more resistance there is.
Yeah, it's not flimsy.
Yeah, nowhere near as flimsy. And now that can now fire up to stabilize your back. Okay.
So if it was an osteo, he would have just done an adjustment
Yeah.
and done the test, and I would have walked away feeling like
$1 million,
that's done.
because the manipulation itself releases endorphins into your body, which is a feel-good factor, and also releases serotonin, which is essentially like a relaxing hormone, rather than sometimes manual therapy is a little bit painful, but look at the difference in responses.
Do you know much about kinesiology?
Yeah,
Like,
bits and bobs.
they do like these types of tests on kinesiology, but they do some other wacky stuff as well.
Yeah, it depends essentially whether you're working through slings, whether it's more isolation. It depends where you learnt all your stuff from, essentially.
Yeah.
Okay. How does your back feel now?
Feels really good.
Yeah. So we're going to do a little bit of hamstring activation, because I believe is a lack of activation that's actually tightening up the hamstring.
Okay.
So you remember you're roughly about 45 degrees, maybe 50 degrees if I'm
Yeah,
being
okay.
generous. Okay. You're going to go knees slightly bent on both sides, toes up, toes slightly turned in, but knees apart so you're in line with your hips. Arms across your chest. You're going to posteriorly tuck your hip, and then holding that brace position, you're going to drive your heels into the ground to lift your hip. A little bit more, hold it there, that's it. Work, don't worry about the height of the hip, mainly work on the tuck. Feel that?
Yeah.
Rest your head back, that's it. Holding this position, straight away, if you come to this side, you can see Usman likes to externally rotate his feet because his lateral hamstrings, his bicep fem, is generally much more active. So we need to offset that and work on the medials. You see how hard that was?
Yeah, and visually my hamstring on the inside isn't as thick as the...
No, because your hips are naturally externally rotated as a result of your
Every time I do
ankles.
hamstring curl for probably 10 years,
Yep.
I've always used bicep more small than inside.
And that's your normal mechanics. So for you, I would coach you in the gym
Do that.
slightly.
Okay.
Offset it
I'm not
slightly.
gonna do that,
Yeah. Double leg, single leg, doesn't really matter.
Yeah.
Okay, we're gonna have to go again. Yeah. So hold yourself in place, toes slightly turned in, tuck the posterior tilt, bridge, a little bit higher. Now, I want you to think about tractioning. So I'm gonna pull you away, you're gonna fight me in constant. There we go. Hold it, hold it, hold it. 10, 9, 8, 7. Keep tractioning. 6, 5, 4, 3, 2, and relax all the way down. Perfect.
It's
Well
an
done.
intense feeling that.
Yeah. But now, when we retest your active range of motion, there should be an improvement. Okay?
Do it again?
Yeah, in your enter. No, just straight leg raise. Nice and slow. How does that feel?
Yeah, I can see my foot.
Yeah. And then let's go to the other side. Big improvement.
Yeah.
Yeah, where were you before?
Like
45 degrees. Have I treated your hamstrings?
No.
No, haven't touched them. Okay, so we need to establish not everything that's restricted in motion is a tightness. Could be one, a weakness, but also an inability to activate.
Yeah.
So what we've done is we've now offsetted the semi-turn, semi-membranosis, so then that will naturally pull your hip a little bit more neutral.
Okay.
Okay, perfect. How do you feel?
My lower back feels like it's stopped hurting.
Yeah.
I don't complain about my back, but I'm just always limping everywhere.
Yeah.
He said he's noticed.
Even just you sitting down on that chair that's meant to be better for your back, standing up, you're almost like tucking underneath
No,
you to
I'm-
slowly.
You definitely do that. You walk sometimes like
Scooping his bum to stand up.
I
Yeah.
just grind through it.
Is that what you tell your clients?
Yeah, that's
Yeah.
it.
Let's sit you up. Squeeze your tummy. Let's go. How did that feel coming up?
Yeah, very good.
In the middle,
And normally I can't even sit like this.
because it shudders in your back, doesn't it?
Yeah, I have to do this.
Yeah.
I can't normally sit like that. I don't know what to do after what you've done, like how to keep this feeling.
So what I would do is then put a prep program for you, essentially based on what I've seen. I would get you to do a couple of posterior planks, offsets in the medial hamstring, work on the psoas, a little bit of activation in the glutes, but the main thing for you is your adductors.
Yeah.
They're just not firing to stabilize. So the
And
whole point of the
also,
adductors-
like, that's why I've got more good mobility, because they're not strong.
yeah.
People think it's mobility,
Well,
but it's actually weakness.
The thing is, if it's weak, it won't allow you to go to that range. But this is the natural mechanics for you. The thing is, if I got you to squat, feet facing forward, the optimal way,
I can't do it.
you can't do it because we need to look at the Q angle of your hip joint.
Yeah.
Because everyone's hip joint sits slightly further back.
Yeah.
Okay. So depending on your presentation, I would then get you to squat what is natural for you. But then squatting with this is not natural.
And my feet need to be like here.
Yeah. Roughly about 0 to 30 degrees I'm happy with. Anything beyond that, we need to now address.
I'm probably 45.
Yeah, you're probably a bit further out. So we need to start addressing the ankle.
Yeah.
Okay. So even just addressing the ankle here, trying to pull up, there's that bit of resistance. Have you rolled your ankles before?
I think maybe once, I think.
Yeah.
Not really.
Not badly.
No.
Yeah. So stay nice and relaxed. So what I'm going to do is I'm going to glide the talus back. You can feel that. Can you feel that?
Yeah.
Now, if I go into a further dorsiflexion, now you should feel a bigger stretch in the calf, less pinching in the
I've
ankle.
never had to stretch the top of my calf like that before.
Have you not?
I've never felt the top of my
Yeah.
calf.
So now,
I can feel it at the back of my knee, and I've never actually felt that.
so what you're feeling is more hamstring. Can you
Or
feel that
because
now?
the hamstring tendon's right at the back of there.
Yeah, yeah.
I never even.
Because they
normally
cross
feel
over
that.
like that.
See, I never even normally feel that. Never felt that
Because
before.
all we've done is glide the talus back.
It's a strange feeling because I've never felt that before.
Yeah. So now you should get a nice big stretch in. You feel that constant
Yeah,
pops. Yeah. Now I'm going to release the ankle through a manipulation, so you're going to stay nice and relaxed. Deep breath in, all the way out. Let your body drop. Good. Do you feel that? Feel that pop?
I think the bed made a sound, so I didn't hear the pop.
Oh, okay. Yeah. So
But
now
I do
if,
feel it's freed up.
if you move that ankle around compared to the right one,
Yes, the left's freer.
yeah, a lot easier, right?
Yeah, a lot freer.
So now if I go into flexion, can you start to feel that stretch as normal now?
Yeah, it feels good.
Yeah, cool. And then if I do this side. So if your ankle doesn't go into dorsiflexion, where does the range has to now come from? The foot.
Yeah.
So then that's why your foot externally rotates and it creates pronation.
But you know, that makes sense. I never even thought of that.
Yeah. So then if you now look at the bottom of your shoes,
So it's an ankle issue, not. It's actually like it's my tib putting the pressure on the inside of my ankle rather than putting.
your navicular.
Yeah.
Your navicular is dropping as a result of your talus not being able to flex. So then your foot has to externally rotate to get the range. And then what you find is after a while, your foot will develop bunions.
So,
Yeah, you
it has.
haven't already.
Yeah, it has. Yeah.
Yeah.
But you didn't know I know all this shit.
Yeah, you know, I think,
Yeah. One more activation, then we're going to get you to do another single leg squat, and you tell me the difference in terms of stability.
Okay.
Okay. Straight leg. From here, you're going to squeeze in, make contact onto my fist. Good. And then from here, build up resistance until you hit your maximal.
Just inside.
Yeah, just squeeze. Come on. Is that your
No
maximal?
power, no power.
Yeah, you go to what your maximal is. 1, 2, 3. Flatten your back onto my hand. 4, 5, 6. Come on. 7, 8, 9, and relax. Good. Bend your knee at 90 degrees. So we've now fired our adductor magnus. Now slowly build. Slight posterior tuck. Brace your abdominals. Keep that
It's gonna
pressure.
cut my groin. That.
Yeah, come on. Push, 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 push. You may feel a bit of a manipulation into your pubis, okay? Keep going, keep going, keep going, keep going, keep going, keep going.
There's no power there.
Yeah, there's literally nothing there at all.
No.
Yeah. So that's, honestly, the first thing we need to address is to make sure your stabilizers are working. Your back will be squeaky clean.
So I want to start running.
Yep.
And this is going to really affect me because I can't really run. Because when I run, I just run like a penguin.
Not just that. The thing is, you have to earn the right to run.
Yeah.
Your body's nowhere near at that stage yet.
That's my goal. I want to run.
Yeah, so I'm going to double up the fist this time, just so you've got more of a nicer range to work in. Lift your feet up, toes touching but heels apart. Yep, perfect. Now slowly, head back, tuck the hip, brace your abdominals, slowly build up resistance. Squeeze in. Yeah, that's it. Now, go to whatever range you can, now hold it. Hold it, 1, 2, keep it constant, 3, 4, 5, come on, 6, 7, come on, keep going, 8, 9, and relax there. Yeah. I can guarantee, address this, address this, address that, and your psoas, your back will be absolutely fine. So we just finished with our client Usman, who generally sit downs for a living. He's sitting down 10 to 12 hours a day, maybe a little bit more. He has shown symptoms of lower back pain, which essentially sitting down for more than 10 minutes to standing is crippling. So we started off with the assessment with the scan. So we did a postural scan and movement scan, testing overhead squat and single leg squat, looking for any asymmetries within the body. After that, the readings and the findings and metrics of the scan, it dictated where I was going to head with the assessment. By addressing that, we released the psoas, activated the psoas, released the hamstring through activation, posterior plank, and also activate your adductors. And from that, he's been able to flex forwards without any pain.